Hello everybody, welcome back to our channel Nursing Career Club. Today we will discuss about GDA topic Unit 1 Introduction to Healthcare Systems. Introduction. Healthcare systems encompass a broad spectrum of organizations, institutions, professionals, and resources dedicated to maintaining and improving the health of individuals and communities. These systems vary greatly from one country to another due to differences in political, economic, cultural, and social factors. However, they all share the common goal of providing accessible, affordable, and high quality healthcare services. We can define it as a healthcare is a broad function that provides the proper treatment to the patients from one country to another country and at the different places of the country with a dedication, and they also work on to improve the quality of the medical services so that the patients can be saved from the various diseases and the lives of the patients can be saved at a high rate. Besides it, the common goal of providing these services in the every corner of the world that improves the healthcare services, and it is very mandatory to keep a control on the healthcare services. Basic understanding of healthcare services. Primary healthcare providers. Primary healthcare providers are healthcare professionals who serve as the first point of contact for patients seeking healthcare services. Primary healthcare providers are the hospitals and dispensaries which provides the proper treatment to the patients for the spontaneous recovery of the patients, and they also work on the quality of the medical services with the different equipments at the different places so that the health can be in a good condition and the patient can recover very soon. They are typically generalists who provide comprehensive and continuous care to patients of all ages and genders. They are the generalists. They provide the particular treatment to the patients in the hospitals and in the dispensaries with a total quality of the Medicare, and they also provide the quality medicals and the medicines of the quality so that the patients can be recovered very soon. So this is all about the primary health care providers. Key roles and responsibilities of primary health care. There are various responsibilities of the healthcare providers such as preventive care, diagnosis and treatment, chronic disease management, coordination of care, health promotion, patient education. So, this is all about the key roles and responsibilities of the primary health care. Secondary healthcare providers. Secondary healthcare providers typically refers to specialists who focus on specific areas of medicine and provide more specialized care than primary healthcare providers. Secondary healthcare providers are better than the primary healthcare providers. They immediately provide the health care to the patients, and they also provide the first aid to the patients so that the patient's lives can be saved at a high rate. They are often consulted by primary care providers when patients require expertise beyond the scope of primary care. Here are some examples of secondary healthcare providers. So, secondary healthcare providers are better than the primary healthcare providers. They provide a quality Medicare to the patients, and the medicines are also in a good quality, and they provided the services at the hospitals and at the dispensaries. So there are several parts of the secondary healthcare providers. Specialist physicians, the physicians are very specialist in their field. Surgeons who operate the patients. Psychiatrists are related to the psychological patients and mental patients. Radiologists Radiologists are commonly reliable for the various tests. Anesthesiologists, ophthalmologists, obstetrician and gynecologists, physical therapists. Now we will discuss about tertiary healthcare providers. Tertiary healthcare providers represent the highest level of specialized medical care available within the healthcare system. And the tertiary healthcare providers are the best healthcare providers in the sector of medical field, and they provide the Medicare from the zero level to the highest level, and they also cure the patient while the treatment is going on. They also give an advice to the patient to take light food. They focus on managing and treating complex and rare conditions that require advanced technology, specialized equipment, and highly trained medical professionals. And they use the technique of the medical treatment, and they also use the various equipments for the proper treatment of the patients, and they work on the quality medicare so that the patients can be recovered very soon. Tertiary healthcare providers often work in large medical centers or specialized hospitals. Here are some examples. So, tertiary healthcare providers in a large number of the centers or specialized hospitals. There are some examples: quaternary care specialists, medical centers of excellence, highly specialized surgeons, specialized intensive care units, advanced diagnostic and treatment technologies, academic medical centers, rehabilitation centers. So these centers provide a better treatment to the patients at a lowest charges and in the early recovery of the patients. And patients can take the advantages of these centers as a proper medical care. The various services offered to patients in hospital. Hospitals offer a wide range of services to patients, spanning from basic medical care to specialized treatments and support services. So hospitals provide a good range of services to the patients. and with the technical equipments, and they also use the good terms for the treatment, and the specialist doctors provide the medicare to the patients so that the patients can feel better than before. Here's an overview of the various services typically provided by hospitals. So we are going to produce a overview of the various services which are provided in the hospitals by the doctors. First one is emergency services, emergency department, immediate medical care for acute illnesses, injuries and emergencies. In each and every hospital there is a emergency room where the doctors provides the early treatment to the patients. Such as accidental cases are treated in the emergency rooms. Trauma center, specialized services for severe injuries and critical conditions. Trauma center is reliable for the various body tests like a CT scan, MRI, and everything else. Ambulance services, transport and pre-hospital emergency care. Ambulance is provided for the immediate approach to the hospital so that the patient can be admitted in a hospital at an early stage, and the treatment of the patient can be started earlier. So the ambulance is very mandatory for the transportation of the patient from one place to another place. Inpatient services, hospital wards, units where patients stay overnight for medical care and monitoring. Hospital wards are responsible for the admission of the patients, and the patients also stay there till their treatment is going on. Intensive care units, critical care for patients with life-threatening conditions requiring close monitoring and specialized interventions. So ICU is very necessary for the patients who are in a critical conditions and they are fighting with their life and death. So in the ICU, the doctors provide a close monitoring to the patients, and they and every time the doctors keep an eye on the patients, and they also check the pulses and the heartbeats of the patients. Specialty units such as maternity wards, pediatric units, and psychiatric wards. There are specialty units in the hospitals, like as maternity wards, where the ladies are admitted in the case of delivery, pediatric units, where the accidental patients are admitted, and the psychiatric wards. And in a psychiatric ward, mentally and psychologically ill patients are treated and they are admitted in the psychiatric wards. Diagnostic and imaging services, laboratory services, blood tests, urinalysis, microbiology, and other diagnostic tests. Laboratory services are provided to the patients in the various types of the body tests like a blood test, urine test, and microbiology and other diagnostic tests. Radiology, X-rays, CT scans, MRI scans, ultrasound, and other imaging studies. And in the radiology department, the X-rays of the broken part of the body like a a patient's hand or leg is broken down, then the X-rays is to be done to catch the fracture area of the that particular part, and the CT scan is provided for the head or mental problem, and MRI is the treatment for the joint disease, and there are ultrasound and other imaging studies. Pathology examination of tissues and fluids for diagnosis diseases. Pathology is a department where the examination of tissues and fluids are done and diagnosing diseases. Treatment and therapeutic services, surgical services, operating rooms for surgeries ranging from minor procedures to complex surgeries. And the surgical services play an important role in the operations of the various body parts from the minor level to the complex level, and various body parts are operated by the different surgeons, so that the fractured part or the part which is under the disease, throughout the surgery the disease can be removed away. Medical treatments, administration of medications, interventions, therapies, and specialized treatments, chemotherapy. And there are many medical treatments like as medication, intervention, and various therapies. Therapies are very necessary for the patients of the skin disease and various painful disease. Physiotherapy and rehabilitation, physical therapy, occupational therapy, and speech therapy to aid recovery and rehabilitation. So, physiotherapy is very necessary for the various diseases which occurs to the patient's body parts, and they suffer from various diseases, various painful diseases. So, physiotherapy can be taken place in that situation so that the patients can feel better than before. Specialty medical services, cardiology, diagnosis and treatment of the heart conditions. Cardiology is the way to treat the heart patients and the problem in the heartbeats. Many patients feel the pain in their hearts, so the cardiology takes place in the heart problems. Oncology, cancer diagnosis, treatment, and supportive care. Oncology is the department which care for the cancer disease, and it is a prolonged treatment for the cancer patients. Neurology, treatment of neurological disorders, stroke, epilepsy, and neurology is related to the mental disorders and mental diseases. And the mental patients are sent for the medical checkup. After that, they are provided the medicals for the neurological disorders. Orthopedics, treatment of musculoskeletal conditions and injuries. Orthopedics is related to the various diseases, musculoskeletal diseases, and the injurious part of the body. So, first of all, the injurious part is observed throughout the X ray or CT scan. After that, the proper treatment is provided to the patient, and various bandages are wrapped around the fractured part of the patient. Support services, nutritional services, dietary counseling, meal planning, and special dietary needs. And if our nutritional services are good, then we can be free from the various diseases. And if a person takes the balanced diet, then he can feel better and he can live away from the various diseases. Social services, counseling, social work support, and discharge planning. Social services are related to the counseling, such as the doctors cons- and the patients take consultation from the doctors, and the doctors give advice to the patients for the proper Medicare management and for the proper nutrition. Palliative care, supportive care for patients with serious illnesses, focusing on quality of life and symptom management. So, this is a supportive care for the patients who are suffering from various types of diseases and they are unable to recover very soon. So, the doctors provide the proper Medicare to the patients in the hospitals and at their dispensaries. Ancillary services, pharmacy services, dispensing medications and pharmaceutical consultations. And in the pharmacy services, the medicines are provided to the patients, and the doctors also give advices to take the medicines time to time on the daily basis. Medical equipment, rental and provision of medical devices and equipment, wheelchair, oxygen tanks. There are various types of medical equipments like a stretcher, cultures, and wheelchairs, and oxygen tanks and CPR. Transportation services, patient transport within the hospital and from medical appointments. So transportation services, there is only ambulance service in the hospitals, which is an immediate transportation for the patients from the incident place to the hospital. Telehealth and virtual care, telemedicine, remote consultation with healthcare providers for diagnosis and treatment. Telemedicine means that there is a online consultancy with the doctors, and they also provide the knowledge about the proper medicines to the patients. Remote monitoring of patients' health status and vital signs remotely. And remote monitoring is such a thing that the doctors monitor the patients remotely, and they also get a knowledge about the vital signs of the patients, and they provide a proper Medicare remotely. Various departments in the hospital. Hospitals are complex organizations that house numerous departments, each specializing in different aspects of healthcare delivery and support. Here's an overview of various departments typically found in hospitals. And, and hospital is like a big complex or a big building. There are various departments in the hospitals like a emergency, room, X-ray room, sonography room, and general ward and dialysis ward. So these wards are very mandatory for the proper medical care of the patients. Emergency department. We have earlier talked about the emergency department where the emergency patients are admitted for the fast recovery, for the fast treatment of the patients. Inpatient wards, hospital units where patients receive overnight care and monitoring includes medical wards for patients requiring medical treatment and observation, surgical wards, post-operative care for patients recovering from surgery, pediatric wards, specialized care for children and adolescents, maternity wards, care for pregnant women before, during, and after childbirth, intensive care units (ICU), critical care units for patients with life-threatening conditions requiring close monitoring and specialized medical interventions. And ICU provides the medical care to the critical patients such as accidental cases and mental cases and also delivery cases. Diagnostic and imaging departments. Radiology department. This department provides the X-ray services, CT scan and MRI services of the different parts of the body. Laboratory services, and in the laboratory various tests take place such as blood test, urine test, and any other diagnosis and treatments. Surgical services includes operating rooms where surgical procedures are performed by the surgeons and surgical teams. And in the operation theater, operations take place by the surgeons with a proper concentration and without any dangerous activity in the operation theater. And the specialized surgeons enters in the operation theater for the surgery. Anesthesia department administers anesthesia and monitors patients during surgery. And anesthesia department play an important role for the patients to make them faint while the surgery is going on. Cardiology department. This department is related to the heart problems and for the checkup of the heart beats. Oncology department. It is a department for the chemotherapy of the cancer disease. Neurology department. It is related to the mental disorders and neurological disorders. And the patients are sent for the CT scan in this situation. Orthopedic department. This department is related to the diseases and injuries. Support services, pharmacy services, and the pharmacy services. Various types of medicines are provided to the patients. Nutritional services. Dietary food is provided to the patients while the treatment is going on. Social work services. Social work services take part in the consultation and advisory by the doctors to the patients for the fast recovery of the disease. Palliative care services offers comfort and support to patients with serious illness, focusing on pain and symptom management. Administrative departments, admissions and registrations. On the receptions of the hospitals, admissions, skeletal diseases and injuries, support services, pharmacy services, and the pharmacy services, various types of medicines are provided to the patients, nutritional services, dietary food is provided to the patients while the treatment is going on. Social work services Social work services take part in the consultation and advisory by the doctors to the patients for the fast recovery of the disease. Palliative care services offers comfort and support to patients with serious illness, focusing on pain and symptom management. Administrative departments, admissions and registrations. On the receptions of the hospitals, admissions is done after the admission, the registration takes place. Medical records manages patient records, documentation, and health information. Medical records contain the medical reports of the patients about the vital signs and the body symptoms. Billing and finance. There is a cash counter in the hospitals where the patients deposit the amount of their treatment, ancillary services, housekeeping and environmental services, and the housekeeping agents work in the hospital for the cleanliness in the hospitals. Maintenance and engineering. The maintenance is very necessary for the long life of the hospital building, and the engineers every time they focus on the buildings and the in the maintenance of the buildings. Transportation services, and in the transportation services, the ambulance service and the vehicles for the doctors, education and research departments, medical education, and there is a education and research department in the hospitals like in medical education. And in the medical education, the proper medical education is provided to the patients for the proper medication, and they are also given a good advice to avoid the various infectious diseases. Research department conducts clinical trials, medical research, and academic studies to advance healthcare knowledge and treatments. Research department is a department where the research take, takes place, and the doctors research about the various techniques for the proper treatment of the patients. Thank you for watching our video. I hope that this video will be very helpful for you. If you want to ask a question, then you can comment in our comment section. And if you want to take our notes, then you can visit on our official website www.nursingcareerclub.com. Thank you again. We will see you in the next video.